Welcome back for another week of our pregnancy video series. This week we're going to go over what prenatal care looks like in our office. So just like with any new patient visit, your first prenatal visit will include first a very thorough assessment. It's difficult, to say the least, to accurately give treatment if we don't understand what the problem is in the first place. So our assessment will include a range of motion check, not just in the area of the complaint, but in the whole body. Everything, again, in our body is connected. So if someone's got a pelvic complaint, but we don't assess the hip or we don't assess the mid-back, we're really doing that patient a disservice by not examining everything that could be related to that area. So we'll begin with range of motion. After that, we'll check more specifics with core and pelvic function. This really varies on a case-by-case basis, depending on what the patient's symptoms are, what provokes those symptoms most, what their goals are, and what stage they are in pregnancy. But generally, every single patient, especially if they're pregnant when they come in, we're going to assess their ability to breathe and generate intra-abdominal pressure. We're also going to check their ability to relax and contract and activate various muscles. Which muscles we evaluate, again, is really dependent on a patient-by-patient basis. But this will generally include muscles through the core, the pelvic floor, the hips, and the low back at a minimum. After our assessment, we get into the fun part, treatment. So treatment in our office almost always will include some type of spinal adjusting. A lot of people say, well, I'm pregnant, I'm already moving a lot. Why should I be adjusted, or why would adjustments be helpful for me? And adjustments, while they're incredibly helpful for joints that are stuck or aren't moving effectively, they're also an amazing way to help the brain be more aware of a certain area and to relieve pain. If any of you have stubbed your toes in the past, you know you hit your foot or you bonk your funny bone, and rubbing it helps to make it feel better. Adjustments can have a very similar effect neurologically. So if we have a joint or an area that's painful, instead of rubbing the surface of our skin, we can flood that joint with sensory information from the adjustment, which can have an amazing effect on the patient's pain. Another major component of our treatment is soft tissue or muscle and ligament release. This is generally done manually or by hand, so we can help those muscles lengthen, relax, and encourage some more mobility through some of those soft tissues. Most pregnant patients love manual therapy in the office, especially when most over-the-counter pain medications are off limits. Manual therapy, especially when combined with adjusting, can be a really great, natural, effective method for pain relief. The last major component of treatment for our prenatal patients is gentle and progressive activation. So with all the changes, again, that happen during pregnancy, we don't want to throw a woman into a heavily loaded squat, for example, without building up the proper foundation first. So we'll always begin with the basics. We'll begin with breathing, good core activation, and as each patient masters that, we'll progress them through so that they're able to apply that to day-to-day tasks in really practical and relevant exercises. The last point that I want to touch on for prenatal treatment in our office is care frequency. What we'll generally say for a woman who is expecting is to see your chiropractor or pelvic floor therapist or other manual therapist the same frequency as your OBGYN or midwife visits. So at the beginning, we think once a month tends to be a really good frequency for most patients. It helps to make sure that everything is well balanced. It helps us to get some of those movement foundations established early on. So before we have a lot of those big changes and complaints that come about, we can set those foundations in place to really set a woman up for success and to have a really smooth and comfortable pregnancy and birth. I think it's in every pregnant woman's best interest to see a chiropractor at some point during their pregnancy, especially considering how much change occurs and how rapidly it occurs. The only time that comes close to the amount of change that happens in pregnancy is the first year of life. So from conception to baby's first birthday or so, they're developing rapidly. tons of changes are happening. And the same thing happens with pregnancy. So if we can see our pregnant patients more frequently, again, that really helps to set that woman up for success in pregnancy, birth, and through postpartum. Stay tuned next week when we cover what we include in birth prep in our office.